Hello, welcome to the next session in the Cardiovascular Rehabilitation Education Series. My name is Guianne Prue, and I'm a physiotherapist in the Cardiac Rehab program. Today, we are going to be talking about goal setting. Setting goals is a habit of effective and successful people, and it is an important part of making lifestyle changes for your health. This session will help guide you in setting realistic goals and action plans to help you move towards your desired outcomes. Of note, this topic is part of your activity guide from pages 7 to 14. I know many of you are using the guide online. You may choose to print this section if you have the ability to do so in your home, or you could just grab a piece of paper to be able to fill out the questions that we pose. If you wish, you can pause this video as many times as you wish to ponder your answers and write them down. I want to point out that although we included the goal setting section in the activity guide, it can be used for setting any lifestyle goal, such as improving nutrition or mental health. As this is not the first session in this series, I know that you will have seen this disclaimer slide before. If you have not, please take a moment to read it over. At the initial assessment to start the cardiac rehabilitation program, we asked you to identify your outcomes for the program. What are you hoping to achieve? If you are not sure, try to think about what worries you about your current health status. What are things that you can personally do about this? Many of you have coronary artery disease and therefore will have risk factors for this disease. Others may have risk factors for many other conditions. We have provided you with your own risk factor profile. By this stage, you will probably have participated in the review of these risk factors with one of our nurses. This risk factor profile identifies possible areas of improvement. For example, we may have identified that your blood pressure is above the recommended target. However, it is up to you to decide what you want to work on. We are inviting you to take an active role in your care, becoming a self-manager. We are simply guides to help you along the way. Some of you will have just a few things to work on, and others may have more than one. That is why you must decide what you want to start with. Change requires many things. First, it requires knowledge about your condition and the factors that affect it. This is probably the easiest step, just to learn about this. We also need a belief in the benefits of changing, also known as conviction. This can take longer. And we also need to have confidence in our ability to make the change and carry it through. At the end of this session, we hope to have helped you take some of the steps towards change. Goals versus outcomes. These two terms are often used interchangeably, but they are different. Outcomes are the result, the long-term benefit of your action plan. For example, to reduce blood pressure or lose weight. The goals, however, are the behavior, the steps to reach your desired outcome, something that you can measure. It is also called the action plan. For example, to no longer add salt at the table. The goals are within our control. The outcomes may be only partially within our control. And this is why we want you to track the goals, not just the outcomes. Decide what you want to accomplish in regards to your health. You may want to manage risk factors or simply return to previous activities. I want you to take a moment now and think about what you want to achieve for your heart health. You may want to choose one outcome you feel is the most important and will have the most impact, or you may feel that you want to choose the one that you're most ready to work towards, the one that you find will be the easiest. Either one is fine. Why change? I want you to consider why this outcome is important to you. It should not be just simply because healthcare professionals have told you that this is a good idea. That may be enough to start, but usually is not enough to carry you through. It needs to mean something for you personally. You want to think about the pros of changing or the cons of staying the same. For example, what could you do if you had more endurance? So this is another time where I want you to stop and think about your reasons for the changes that you want to make. It is also a good idea to revisit your reasons and benefits over time as they may change. And doing so is a great way to help with your motivation. It is often helpful to see what has changed over time, not simply what you feel you want to accomplish moving forward, but also how far you've come in the past. Barriers. We want you to think of the reasons that could keep you from making this change. It could be feelings, thoughts, or circumstances. These are the cons of changing or the benefits of staying the same. For example, you may want to quit smoking, but you're worried that that you will struggle because it is your stress reliever. To be able to move forward, you need to think of strategies to overcome the barrier. So again, I would like you to take a moment now and think of all the barriers that are keeping you from making changes, and then think of some strategies. So you may want to talk it over with friends or family, people that you feel might be able to help you in coming up with possible scenarios or strategies. How important is it for you to make this change? As you can see on the slide, this is a scale of 0 to 10, 0 being not important at all, to 10 extremely important. We want you to take a moment now to rate the importance of the changes that you want to make. This may help you to decide which one you want to work on first. If you have a low score, less than 7, you may not be quite ready to make this change. To be ready for change, we have to view something as a problem. It has to cause us a certain element of distress. We have to feel that we can do something about it. I want to reassure you that it's okay if you don't feel ready for change right now. Change is difficult, and everyone progresses at different rates. You may simply need to spend more time drawing up your list of pros and cons. To help your commitment to change, your list of pros has to outweigh your cons. It doesn't need to be any longer, it just needs to be more important to you. For those who are not quite ready, don't worry. The rest of the session is still valuable information for the future. Hopefully you will gain some ideas on how to proceed when you do feel ready. There are many ways to reach a specific outcome. If you have any difficulty trying to find ways to reach your outcome, we encourage you to look at the top 10 tips, which can be found on the Heart Institute website. And I will show you how to reach that now. So here we have the Heart Institute website. To be able to find the top 10 tips, you go to Patients and Visitors, and then Tools and Resources. And near the bottom here, you will find Cardiac Rehabilitation Top 10 Tips. So as you can see, we have some for emotional health, exercise, healthy eating, sleeping, managing stress, and a few others. While I'm here, I might as well just show you also how to find our educational guides for the rehab program if you were still not sure how to find them. So same place under Patients and Visitors and under Tools and Resources, you have the Cardiac Rehabilitation Guides. The physical activity is first, and then the other ones are there as well. So now that you have looked at some possibilities, you need to choose one strategy to work on. So for example, when we go back to blood pressure, one person might decide to reduce their sodium or salt intake. Another person might decide to work on their stress level. Other people might decide to start exercising, or quit smoking. These are all things that will help in terms of managing blood pressure. The next thing you need to consider is how hard you're willing to work towards your outcome. As previously mentioned, change is hard, and you have to decide if you are willing to keep working even when you do not see immediate benefit. It's of course easier when you do, but that isn't always the case, and you have to decide just how far you're willing to keep working. If you're not sure, you may want to try a different strategy or work towards a different outcome. The next step is to take the strategies that you chose and turn them into concrete action plans. Some of you may be familiar with SMART goals. SMART goals can't come from the management world, but they have been used extensively now in healthcare, specifically for lifestyle changes. So SMART is an acronym for specific, measurable, achievable, relevant and rewarding, and timely. So we want to put as many details as possible into our plan to help us achieve it. We want to make sure that it is something that we can measure and that it's something that we feel that we can attain. So it's good to go with small changes. It has to be meaningful. And you have to also put a timeline on it, at least a time that you will reassess your progress. So these are examples of a goal that is maybe a little bit more vague and how to make it a little bit more specific. So instead of simply saying, I plan to eat healthier, in this case, the person decided to make it specific in terms of increasing intakes of vegetables. They put something specific in terms of the amount, 3 servings, and when they were going to start, and how it's going to happen. So at lunch, one as a snack, and then one at dinner. As I said, it has to be measurable. So instead of simply saying, I want to walk further, you might make it, in this case, it's a very specific goal to be able to do a 5-kilometer walk as part of the race weekend. And then you will have to put in how you want to reach that target. So starting by 1 kilometer. Achievable. So I will walk more. It may be that you don't have the time to do a full 30-minute walk during your schedule, at least on most days. So in this example, the person is deciding to get off the bus earlier, both before going into work and coming back from work 5 days a week, and this is how they'll achieve their 30 minutes per day. Relevant and rewarding. So instead of saying, I'm going to exercise more because my doctor told me to do that, I'm going to start exercising because I want to be able to keep up with my grandchildren. And in terms of a time frame, so instead of saying, I'm going to talk to my doctor about my blood pressure, specifically putting, I'm going to make an appointment before the end of this week to talk to my doctor. And I realize you may not get the appointment the same week, but you're going to make that call about the appointment. So again, we want you to now take a moment, and I realize that this will be a slightly longer moment, to think about how you're going to turn your goal into a specific action plan using the SMART acronym. Much like we did with importance, we also want to think about confidence. How confident are you that you can achieve this plan? So again, we want you to rate it from a scale of 0 to 10, 0 being not confident at all, and 10 being completely confident. If your answer is 7 and above, this is probably a realistic plan for you. However, if your answer is below 7, you might want to rethink your action plan. Ask yourself why you are not certain that you can achieve this plan. Is it because there are barriers, or maybe you made it too difficult a step to begin with, too big a step? See if you can come up with some solutions to solve the problems, or you may want to change your plan to one that you feel that you are more confident in. Tracking your progress. Now that you are ready to put your plan in action, you should keep track of your progress. We strongly encourage you to record it using some sort of tracking device. It can be low tech, it could be on a piece of paper, a diary, a calendar on the wall. I had a teacher who would give themselves stickies for doing their exercise that day. Or it can be high tech, using an app on your phone, using a smartwatch, an activity tracker. There's many different ways that you can keep track of your goals. I'm giving you some examples more for the activity, but it can be the same for other things as well. There are certainly apps for tracking your nutrition. In terms of trackers, we have put examples of that in your activity guide in the goal setting section. There is also other logs for activity on pages 70 and 71 for the aerobic exercise and for the strength training. And likewise, in your nutrition guide, you do have a place to make action plans for the different top 10 tips. Tracking your results helps you to notice difficulties if you're not reaching your goal from week to week, and if you are, how you can progress them. So when assessing your progress, there are 4 possible scenarios. The first is the best. You have reached your goal and it was fairly easy and you feel ready to move on. So then you progress your goal, but you do want to make sure to do so gradually and keep it realistic. If you were aiming for 1 serving of vegetables per day, maybe now aim for 2 servings and don't jump ahead to 3 or 4. We also caution you when you make your goals about simply restating the targets or the guidelines that have been given to you. It's absolutely fine to take your time to get there. And if you don't get there 100%, any is better than none. If you reached your goal, but it was difficult, it took everything you had to get there, keep the goal the same for at least another week or 2. You want to find that it's getting easier to get there before you jump ahead to the next step. If you did not reach your goal, but you know why, maybe there was a circumstance, a situation that will not necessarily happen again, then maybe you can just keep things exactly the same. However, it may be that you need to have a different strategy. So for example, if you plan to exercise in the morning, but you've ended up having a lot of meetings in the morning, maybe you need to make it more at lunchtime or after work. So again, you may keep your goal the same or you might change it. And if you didn't reach it and you can't necessarily find a new strategy, you may need to tweak your goal a little bit. So again, we do encourage you to make them realistic goals because it is more encouraging to reach a goal that was maybe a little smaller than to have to backtrack from one that was very demanding. Problem solving through difficulties. If you have struggled to reach your goal, try to determine the cause of your difficulty. And for this, we need to be very honest with ourselves. For example, you don't want to say, I ran out of time, when the reason really was that you lacked motivation. And on note on motivation, so sometimes I get participants saying, I was lazy. And I think that's maybe not the best approach. You may be absolutely devoted to something that is important to you. So not lazy, but maybe not motivated towards that particular goal. So again, trying to figure out why it didn't work is important to help you find the correct strategy. So the steps to doing this is to identify the problem, again, list your possible solutions, select one new solution to try, reassess your progress again, typically in a week or so. And then again, you may need to find another solution if that one didn't work. And I want to reassure you again that it's completely normal to have occasional setbacks. It's important to avoid blaming ourselves and thinking the worst that will happen. You want to think of the factors that led to the setback. Think about the how, the when, the where, instead of just the why it happened. The important thing is always to find a way back to get on track again towards achieving your goals. Another good strategy is to try and think ahead and identify high-risk situations and make a plan for it. If you're going to a get-together and you know there'll be a lot of food, you may want to think about how you're going to manage that so that you're not overeating or eating lots of high-calorie foods, or if you know that people will be visiting and you might be missing your usual time to exercise, that you make a plan to do it at a different time. Social support. Some people are very independent and self-sufficient, but most people benefit greatly from the support of people around them. Another thing to remember is that our loved ones are not always sure what they can do for you or how it will be received. So it may be important to tell them, discuss it with them, what you think would be helpful. Otherwise, they may hesitate. And can be somebody to do the change with you. It might be your family deciding to change their nutrition habits. It might be, again, somebody from your household coming to exercise with you. Sometimes we have to be more creative. I had a participant who would get on her treadmill at her home, and her sister who lived far away would get on her piece of equipment somewhere else in her home, but they would talk to each other over the phone while they exercised. Sometimes it can be somebody to just simply check in on a regular basis, especially when you're done the program and we, the staff, are no longer checking in on you. It might be important to have somebody else do that quick check-in. Ultimately, we are responsible for the changes, and we're accountable to ourselves, but sometimes it helps to have somebody else do that check-in, or somebody just to help cheer us on and motivate us, or sometimes someone to give us some examples of strategies to try. So lots of different ways that social support can happen. And like I said, if you think it's beneficial, do reach out to your loved ones to seek that help. And finally, rewards. It is important to reward ourselves for a job well done. Ideally, we want to think of a reward that will not set us back in our achievements. Rewards are very important in helping motivation to continue working hard. And only you know what is a meaningful reward for you. They don't have to be big. For example, it could just be that you want to read the next chapter of your book, but you won't let yourself do it until you've done your exercise that day. I have to say I do that for house chores. So again, it's absolutely fine to have that little external carrot to help you move you forward, especially in the beginning. It might be very helpful. And again, I want to close on reminding you that change takes time. You have to be patient with yourself. If you don't reach your goals the first time, try again, but possibly try something different. And most importantly, recognize and celebrate your successes along the way. And finally, just a reminder that if you have questions or you need help with strategies, as part of this series, you do have a mentor who's working with you. So that mentor or resource person was the person who did your assessment at the beginning of the program. And so if you need their support or have questions, we invite you to reach out to them. Thank you again for your attention, and have a great day.